in this exercise, we're going to work on abdominal mobility using our Tim Tam 6-inch ball here. I like this Tim Tam ball because it's a little bit larger than, like I say, a traditional softball would be, which disperses pressure a little bit better, especially when you're doing something like an abdominal type mobility work. And it has just the slightest amount of squish that I think helps make it more comfortable. There are products that are really soft for abdominal type mobility work. The Chorus ball comes to mind. Corgis ball, I believe it's pronounced. It's nice, but sometimes it almost feels too soft, right? So just make sure you're in control. We're going to use our forearms and our knees and our legs to kind of keep the amount of pressure that we want. And I think you'll be able to keep it relaxed that way. This certainly isn't something you're trying to smash, more of a relax into it technique. We're going to hunt around just like we always do. When we find a spot, we'll spend about 30 seconds there. But again, our purpose here is to really relax into it. A couple of key things that you want to look for, I call them the corners, right? So if we start in the middle of the belly and you come up into the right upper quadrant, kind of right below the ribs here, where the abs, the inferior edge of the diaphragm attaches, your liver sits underneath there, commonly tender spot. We come down into the right lower quadrant, you're going to have a valve between the small and large intestine that can sometimes bother people. Also, hip flexor is going to run in that lower right quadrant, so that can be a tender area in and around the hip flexor. On the left side, left upper quadrant, again, this top corner, again, looking at that abdominal attachment, bottom of the diaphragm, your stomach and your pancreas are going to be underneath there. And then lower left side, pretty much just colon, rectum, coming down through there. And then, of course, hip flexor. So, again, gentle pressure, relaxing into this, just looking for our tender spots. Okay, let's go ahead and get started. For whatever reason, I almost always start on my right side. So we'll start with the ball in the middle. And I'm just going to kind of start mid upper right. I'm just going to kind of look around and then try to relax my abdominals and just kind of let my body weight settle into it. I'm just going to follow the rib, below the ribs. I don't want to be on the ribs. I'm just going to let myself settle into it. There's a tender one there. We'll stay there for about 30 seconds normally. For the sake of the video, we're going to move it along. Work my way down. Sometimes you'll find stuff in the midpoint. And you can get all the way down into that lower right quadrant. And now I'm hopefully getting into a little bit of that iliacus or psoas. But certainly getting some feedback through the, through the belly. Tapping into some of that autonomic nervous system, hopefully. Okay, and then we'll switch sides, do it again. I usually like to start on the top again, so we'll go back to the left. Start up nice and high, below the ribs. Just let it sink in. Move around, find a tender one. Spend some time. And then make your way down towards that hip. And again, we'd be spending a little more time here if we were not shooting video. There's a real tender one. I'm right off the hip crest. Just a nice deep ache. Nothing sharp, nothing pinchy, nothing tingly. Nothing that makes me feel like I gotta go to the bathroom. And that can be real nice. When you're done, it should just feel like any other soft tissue mobility session. It should feel comfortable. I've had it made me feel just a little upset tummy just for 30 seconds or so, but that should go away really quick. This is not a high force technique. You should feel that relaxed pretty quickly. And I've had days where it helps my back pain. I've had days where it helps kind of some weird stomach, gurgliness or whatever. So it can be a really, really nice technique to use. Just, again, be careful with your force.